Lori Rose Benson, Executive Director and Chief Executive Officer of Hip Hop Public Health. And I'm dying to hear more about what Hip Hop Public Health actually means, and I think Lori will be more than happy to talk to us about that.
When we started, looking at behaviors to prevent and mitigate COVID, of course, hand washing was the first thing. We were creating resources in English and Spanish, and then mask wearing. And then when it came to vaccine literacy, we realized we couldn't just create one resource. There were many different reasons why people would be excited about or not excited about participating in vaccination. And we called our campaign educational resource series Community Immunity. Immunidad Comunidad, right? So it's all about us, not about me, it's about we. And then when it came to creating resources, we broke it down, because we're Hip Hop Public Health, we got to break it down. And we broke it down to these very small bites. After doing lots of focus groups in different communities with young people, with families, with intergenerational households. So we broke it down into literally 1-minute bites. So addressing, historical mistrust of the medical system was one. Addressing mis and disinformation was another. Addressing, what are the side effects? And as science would evolve and things would change, we'd have to add more. So we started with 4 songs and videos. Then it was 5, then it was 6, then it was the variants, right? What's the deal with the variants? And then when teens were able to get the vaccine, and we all knew that teens were so much more mobile than everybody else, that's when we applied for the CDC Foundation grant, and we created Teen Takeover Community Immunity. And then we worked with teen artists. We created a national version, but then we worked specifically in Baltimore to focus on Baltimore. So the video that we created for Baltimore looks different than the national version. The Be More, I'm a New York City girl, so Be More is a little bit different, but we had to learn, right? And we had to talk with people on the ground and with people and with communities. So creating this really tailored, culturally tailored, fact-based. We once had a video that talked about you either get 1 shot or you get 2. We had to change that, right? As things evolve. So being responsive from that messaging standpoint was really exciting for us, and continues to be as now younger people, our littlest school-age children, can be supported. And I think the last thing I would just like to say about this is, how do we help, when I think about the K-12 population, how do we help teachers do a better job at this? Because it's a tricky conversation to have. So we made it easier. We created lots of wraparound lesson plans, explainer videos, things that can go home with families, so the teachers aren't just talking about, okay, get the vaccine. Especially teens don't have that autonomy there. But it's about, let's think about yesterday. If it's raining outside, right? You might have one of those lovely umbrellas. Thank you, Aspen Institute, for having umbrellas from place to place. And you might have a raincoat, but you still might get a little bit wet, right? So understanding the continuum of coverage and continuum of support that vaccines can provide, but then all the other health behaviors that we don't want to forget about, and just focus on that.
Thank you again very much. Appreciate it.